Dr. Lara. Today we're going to talk about dentures and how they compare to natural teeth and how they compare to dental implants. Many people are familiar with dentures. It is a set of false teeth, typically replacing both upper and lower teeth. They can be made for just a single arch to replace just the uppers or just the lowers. Dentures are a set of either plastic or porcelain teeth built on a pink acrylic base that looks like gum tissue. The dentures work in your mouth by resting on the residual jawbone that is left over when all the teeth are extracted. This jawbone is very important to the fit of dentures. The jawbone's job is to support teeth. Once the teeth are extracted or removed from the mouth, the jawbone has no purpose anymore, and so it begins to shrink. The larger the jawbone is, we call it the ridge, the larger that ridge is, the more support there is for a denture to rest on. Over time, as the jawbone shrinks, dentures can have a worse fit and have more looseness as an airspace opens up between that bone covered in gums and the denture base. Now, the pros of dentures are that they are relatively inexpensive. When you consider the number of teeth that they replace, they are relatively inexpensive. The cons are that they don't work very well. Dentures are not attached to anything in your mouth, and they can therefore be very loose. They typically are bulky because there is a certain amount of acrylic that's necessary for the denture to rest on that jawbone and function properly. They also don't look very natural in most cases. Most of the time, they look like false teeth. The maintenance of dentures, many people think that there is no maintenance required. Once you get a set of dentures, you never have to go to the dentist ever again. Well, that's not the case. Dentures do require some maintenance, and your mouth still requires some evaluation by a dentist. It's important if you wear dentures to see your dentist once a year. You need to have an oral cancer screening done, and you need to have an evaluation of all the soft tissues and the jawbone done so that we can maintain the proper fit of your denture. There are some procedures that can be required in maintenance of dentures listed in the blog. Please read that for more details. Now, how do dentures compare to natural teeth? In general, when you try to compare dentures to healthy, good, natural teeth on healthy, good jawbone, there is no comparison. A denture is loose. It will not function properly during speech or during chewing. You can't produce as much chewing force with the denture as you can with your natural teeth. And so if you have a choice, stick with natural teeth. Now, some people do not have natural teeth that are healthy, or they don't have a natural jawbone that is healthy. In those cases, dentures may be a good option. Many people adapt to dentures very well, and they can function good enough. I had one patient who could actually chew gum in his dentures. That's pretty serious adaptation, and it's not normal. But it is possible. Now, if you are one of those people who has not adapted well to dentures, if you have trouble with the looseness of dentures or with them feeling too bulky, or if you cannot chew properly or speak properly, you may want to consider dental implants. Dental implants are a very diverse tool that we use in dentistry. They can be used to replace one missing tooth, or they can replace and support an entire set of dentures. Now, for dentures supported by dental implants, the way that it works is the implant body or root form is placed into the jawbone in various positions, and that helps to maintain the jawbone. That shrinkage that we discussed earlier doesn't happen if an implant is present, so you're already maintaining the bone better than if you have nothing. Once the implant is placed and the bone has locked into it, an abutment is placed outside of the gums above the implant. These abutments have different varieties, which you can read about in the full blog, but in general, they provide a connection between the denture and your jawbone. And so now there is an attachment that gives the denture a firm foundation that it can lock onto. There's no looseness of the denture anymore. You don't have to rely on muscle control. Because of that, the denture base can be trimmed back and be much smaller, so it has less bulkiness, less gag reflex, less effect on your speech. And so it can create a much better and more comfortable scenario. If you are already wearing dentures and you're interested in implants, or if you think you're in need of dentures, Please read the full blog. There's a lot of detailed information there for you. Or if you have questions, please call and come see us at our office. We'd love to help you out. Thank you for watching and have a great day.